All right, let's get to our first discussion of the day. It's about 3 years since coronavirus, commonly called COVID-19, hit the world unannounced, closing all borders and keeping every citizen on lockdown. Now, there seems to be a resurgence of new variant cases in China, affecting about 37 million people, according to Bloomberg. Health workers and medical bodies in Nigeria have now expressed worry about the federal government's refusal to place travel restrictions on inbound passengers from China in the country. According to them, Nigeria does not have adequate human resources to handle another pandemic as a result of the massive immigration of health workers to other countries. Joining us now to discuss this critical issue is public health consultant, Dr. Tuyi Mebaondu. Dr. Mebaondu, nice to have you join us this morning.
Happy New Year.
Happy New Year. It's good to see you in 2023.
Always a pleasure, yes.
Of course.
Yes.
Now, the COVID, the world has not fully recovered from the impact of COVID-19 that hit every part of the world in 2020. As it is right now, maybe because life had returned to normal, everybody going about their normal duty, it looks like we didn't have COVID again until now that we're hearing that the numbers are going up again around the world.
Yes, indeed. I mean, this is our fourth year. We've seen as much as 668 million cases of COVID-19, 6.7 million deaths, and we've deployed as much as 13 billion vaccines, about 801 of those vaccines, million of those vaccines in Africa. But Nigeria just did about maybe 8 million, 8% of that number. So entering 2023, key issues. One, China ended zero COVID policy. What that means is that all the lockdown and constraints they put on people were unleashed because of the riots that came subsequently from that. So, of course, and then you know that their lunar months, they're praying for their lunar months. The people have to travel from the main cities to the villages. And then China is not declaring completely. In fact, WHO expressed concern that we're not getting truth from China as per the number of cases of COVID-19 because, you know, the number they are declaring is not tallying with the number of deaths they're seeing, especially when we look at the crematorium. Now, secondly, there's a new subvariant of Omicron. You know, we have Alpha, Delta, Beta, you know, and then we have Omicron. Omicron is having some subvariants, which, of course, XBB 1.5 is a new subvariant, which is responsible for as much as 40% of new infection in U.S., and the Omicron is the subvariant is in about 70 countries as we're talking. And then the new cases, you know, average cases has gone as much as 500,000 worldwide. A lot of concern because, again, if you look at the countries that are actually trending with this new surveillance, China is there, US is there, India, Singapore, you know, and these are, of course, are UK. These are, of course, closely connected countries to Nigeria. And then if you situate that within what we are facing now, okay, you can imagine, since the advent of COVID, we've done less than 6 million testing in a country of 206 million. So only 6 million testing. Out of those 6 million, we said, okay, we have 266,000 positive cases. You know, we have 3,000 or thereabout deaths. But still, we still have, free cases, cases that can infect people in Nigeria, according to our data. You know, about 3,000 also. So the question is this now, it's only what you test that you can find. That's number one. So capacity to test is still constrained. Secondly, a lot of disinformation is still there. People who come and tell you that, I didn't take vaccine, I'm not going to take it, because that is still the thing. And then, of course, everybody's opening his faces, nobody cares, overcrowding everywhere with pretend as if nothing.
In fact, it seems strange if you're using the face mask right now.
Yeah, indeed. And the fundamental is still that as long as you have the COVID spreading, mutation will occur. If you want to stop mutation, you have to actually ensure that the spread is curtailed. So if you see now, that's why you see that the Omicron appears to be the most susceptible variant of the COVID-19 because it spread easily, okay, does not cause much death, can just jump from one person to another. because they can jump within the community, it then have capacity to mutate and bring other variants, which we don't know what it may be. Right now, we seem to be on the winning side. Yes, the new variant has both positive and negative aspect to it. The negative aspect is that it spread easily, from one person to another and can infect as many people, 40% in America right now. But the bad aspect is that, the good aspect is that it's causing less severe infection. Okay. But who knows what the next strain is going to do.
Now, let's talk about this issue of China not declaring the true numbers of things. One wouldn't know what the political or the economic or the issue or the social issues are, but it looks like the entire world is helpless regarding what China is doing or how they can compel China or how they can persuade China to be open to the world so that everyone can prepare. Because it's about humanity, not just about the country right now.
The geopolitics and what I'll call the pandemic diplomacy is affecting a lot of things in the world. Initially, Donald Trump tagged the virus, Chinese virus. It became a point of stigma at a point in time where they had to actually be limiting people coming from China into some other countries. Then on the political front, China is looking at it that if I now declare this clearly, it means that one, manufacturing is going to slow down, people will be worried. Two, my people are going to be subject to special considerations. For instance, America had actually issued a warning that if you're coming from China, you have to show certificate of negative COVID test, okay? These are the kind of things, these are the kind of backlash they're trying to fight against. And of course, you saw that the world slowed down economically when China was observing the zero COVID policy. But now it's trying to open up. So there are a lot of cover-ups in this regard. Of course, cover-up will harm public health more, than any other thing. Because it's important for us to know exactly where we are so that we know how to respond to them. And then cover-up will ensure more transmission of the virus within the community and more mutant strain coming up and then disrupting the health system. Yes, we agree that we may not get to the point where we have to lock down the health system again, the country again. Yes, but again, the challenge is still there. Obviously, lockdown is not an option in the world now. We've seen the disruptions to the mental health. We've seen the challenge of post-COVID syndrome. We've seen the challenge of economic and political. In fact, for the first time in China, after the Tiananmen Square, a lot of them were rioting and fighting the government. The government had no choice than to actually, remove the zero COVID policy. So now what we're asking from them is to be open up. And unfortunately, at the level of China, the Sinopharm, the vaccines they gave to their people were not as effective as those ones. And then there are also, the challenge that I have to do my own thing, but it must be something that is very effective that can actually curtail the spread of the new variants. So now, we look up to China to do the necessary.
Now, for us in Nigeria, what are the dangers? Because the issue there is the relationship from trade, politics, and so many other relationships between Nigeria and China seem to be increasing by the day. We have so much Chinese interest on the African continent and so on. What dangers does this portend for Nigeria? What kind of measures should Nigeria be taking generally?
Yes, again, for me, I've always been insisting that we cannot our policy, we cannot be based on luck. Policy has to be policy. We can't say that, inshallah, in Jesus' name, that all these things will be, God is protecting me. Yes, I agree that God is protecting every created human being. So for us, it's that we should, we have challenges in many fronts. And I think that we should start seeking that kind of collaboration with China to see that, listen, your people are coming, we demand so condition. Especially in the area of what I call genomic surveillance. The genomic surveillance must be extended because it's genomic surveillance that will tell you what kind of surveillance or variants that are spreading. We have to extend it to the airports. It's not just doing tests and say positive or negative. The genomic surveillance will help you to look at the level of the airport and look at it and say, listen, what is going on, here? So we have to deepen the genomic surveillance, seek help in that regards. And then, apart from that, we have to also demand negative results because we don't want to quarantine anybody. We don't want to go back to any lockdown. We don't want to hold it. But again, it's important that if you're coming from China, you must have had a negative COVID result. You must have been vaccinated, at least 1, 2, 3 or booster shot, so that, the transmissibility of the virus will be reduced. Of course, what we have to do is that we seem to have forgotten that there's anything called COVID-19. But again, if we do that at our detriment, because what we now need to do is to actually deepen the conversation, especially at the local level, especially where we know that Lagos is an epicenter, Port Harcourt is an epicenter, Abuja is an epicenter. These are the critical areas we have to keep talking. Now, this is a political period where people have to do a lot of campaign, interact with a lot of people. Yes, our vaccine coverage is still far, far less than 20%. I believe for the first dose. What's wrong? We have to really improve on it and then increase that vaccine coverage. Of course, for me, if you're going to attend political rally, we should be able to encourage people to take vaccines. And then, since you are not covering your face, because if the thing spread, where we don't have vaccines, where we don't have health system, where there are no human resources for health, we have too many layers of infections, endemic diseases, cholera is around, Lassa is there, monkeypox is there, name it. We cannot then put this on malnutrition. 133 million people malnourished in Nigeria. We don't want to add COVID to the malnutrition.
Exactly. That's really apt, because now that we have the political campaigns, people are gathering. In fact, if you see the stadiums where people gather for campaigns right now, the crowds are massive. But let's talk about the issue of the state of health, the health system in Africa. Not only Nigeria, in Africa. A lot of people seeing that we've talked, in fact, you've been on the program, we've talked about this issue. Government needs to do more. If you go into the health system, there's a lot of deficit, from infrastructure to profession, to the number of professionals, and all of that. Yet, the prediction or the projection that people were going to drop dead on the streets from COVID-19 didn't happen. So some persons are saying there's something divine or there's something unknown on the African continent. I wonder what you say to this. And a lot of people have said that it's Africa, nothing will happen to us. We've seen that kind of attitude sometimes towards COVID-related issues.
Providence, nature has a way of actually, structuring some things beyond your expectation. Okay. And for science, we say, this is an Eureka. What happened? But we may not actually understand deeply what actually happened in Africa. Is it because we were used to vaccination? Is it because we have a lot of virus roaming around in our environment? Is it because we have some specific immunity targeted at those things? We don't know. We don't know, really. But for me, what virus actually do is to mutate and get the best advantage. They don't really want to kill you, but they want to spread. Given the fact that we have all sorts of chronic illnesses, infections, all around, hanging around in Africa, it becomes important that we don't add to it. That's my own first concern. Given the fact that, in Nigeria, for instance, you're seeing how many doctors per, the recommendation is that, for every 600 people, there should be at least a doctor. In Nigeria, we're seeing one for about 8,000. So minimum 6,000. And then even at that, in Africa, we're housing as much as 90% of chronic diseases, in the world, and we only house to about 3% of human resources for health in the world. So it's a misnomer. But of course, within the Africa, we've seen bright sides. South Africa, Malawi, Lesotho and co. They've been able to really tip and meet those WHO requirements in human resources for health, which is very critical. And then the other thing is that a lot of input you are waiting for in health, because when you look at human resources, you are looking at building resources. I'm talking inputs now, human resources, buildings, materials. Okay, materials like your disposables, your this and that. Critically now, if you look at Nigeria and say that, listen, for instance, we're in need of face masks or gloves or syringes and needle. We still have to rely on other countries to import as much as 8 billion of those syringes and needle. And these are real issue, real problem. So we don't have that level of stability to say that should any epidemic, happen, or should any health emergency happen now, we're covered to this level of months in our consumables. We don't have that, okay? Because you cannot manufacture. We're just reeling out economic challenges we're facing. We can't manufacture. Everything is just down to. But we just don't wait until the mess happens. Then we start running helter-skelter again. Well, maybe church and mosque will help us in prayer. So maybe that's where we are going to go. We can't just keep counting on luck. We can't not just keep counting on luck. We have to do something.
But the issue there is, of course, what you're saying is what is. We shouldn't be counting on luck. But it seems that the average Nigerian attitude to this thing is like, God will take care of us all. And it seems I wouldn't say it seemed to be working, but there's something unknown that we've not been able to explain.
Yes, I agree. Let me tell you something.
Yes.
When you see a cohort, a group of people pushing for hope and displaying hope as their own solution to problem, there's an issue. Government is not doing enough. Government is not doing enough in terms of deploying the health services, providing help for the people, assuring them of their, treatments, and then covering. When you say universal access to health, you are critically looking at the distribution of your facilities, the distribution of health workers, access to health, even when you are not having a dime. Okay, you are looking at all those things. When those things are not just there, okay. You have to either go to church or your mosque or your native doctor, or you just hope and say, well, if I die, I die. It's God's will. So we shouldn't take citizenship. You shouldn't take governance to that level where people have to just hang on to that hope that you don't even have tangible explanation for. Yeah. So, because when it breaks down, because you are not the only person in creation now. When it breaks down, where do you go to?
Exactly.
So in reality, when I hear all these things, for instance, when you start watching television and you are seeing miracle workers, I said, oh, there goes the health system of Nigeria. If it's working, why will anybody carry a case of cancer and say, I'm looking for a miracle in a church or in a mosque? Or because when you know that there are real provision to deal with all those things, even within your system, without you having a dime or a kobo. Okay? But once those things are, when you still look at hungry children, you look around you, squalor, 133 million, multi-dimensionally poor. When you see all those things, and you look at your pocket, there's no money, you don't even know, how to move around. When you want to move around, they want to kidnap you, to be looking for money. You want to move around, you don't have fuel. So the next thing is to say, okay, well, I'm here. I cannot jackpot. Let me just stay and hope that a miracle happens. So, miracle is a tactic, it's a strategy for us now. I hope it keeps working.
All right, now let's talk about this issue of surveillance, because when we hear of variants of COVID in any part of the world, and the NCDC and the Federal Ministry of Health is giving Nigerians an assurance that we are carrying out a surveillance to ensure that nothing comes in, how is that surveillance carried out, and how foolproof is that?
Within the provisions and the ambit of their own ability, the entities assigned is they're really hustling, because you see, what you need is that, yes, you need funding. Critically, you need human resources, because it's not done in regular laboratory. If you have to do a surveillance, I think I know about 3 labs that can actually do those things. And then you still have to, relate to people and share information, because right now, the CDC, is leading in terms of those surveillance, trying to be on top of the surveillance. And these are not cheap technology, okay? What we need, NDDC needs to collaboration. At this point, it's not about training people or looking for people. It's actually collaboration. Collaboration with your partners, WHO, CDC, European people, even China, to actually help you drive surveillance. Because once a case of COVID is positive, what you do is that you pick the virus and sequence the gene sequencing. And know that what is different between this virus and the one we've seen before, okay? And then what does that mean? Are we going to see increased transmissibility, or we're going to see a worse case of infection? These are the 2 critical things you want to really understand in that your surveillance. So, and then when you do the genomic mapping, you need to be able to give information to people. We're having new variant. This is how it manifests. How is it going to be subtle in manifestation? Because the new variants now, You may not have all those kind of sore throats because you just have intense weakness, flu-like symptoms. They actually, because it's new. And then the major challenge that is what we call the long COVID or post-COVID symptoms, which then comes with a lot of tiredness, confusion, mental tiredness, depression. So we are seeing a lot of being unleashed, and it's important that we understand this variant, the gene sequence, so that we know how to respond to them. Unfortunately, medicine moved far away, but we're still far behind cooking leaves, cooking roots, drinking it, bathing with those things, and then opening Holy Book and declaring. We'll see how far those things go.
How would you rate the average Nigerian when it comes to his or her knowledge of COVID preventions and all of those, protocols that are supposed to be taken by an average person? There was a lot of massive, publicity regarding, the washing of hands, the social distance, or physical distancing, and so on. All of those kind of things. And then coughing into your elbow and not into your hands, the use of face mask and so on. How aware how would you rate the average Nigerian person regarding that?
You see what? You know what? The COVID-19 came with a lot of issues. One of the key issues, misinformation and weaponization of information. The doubters, came in, the vaccine hesitants. The people even thought that this COVID is a mark of one beast trying to do that. Some people are saying, it has some chips in and that. And it became so difficult. Just 12 people, 12 people started those campaigns, and the thing went on social media, and we couldn't be able to counter it. And those things are still lingering on, even in Nigerian society now, especially among the religious group who felt that, you are trying to shut down our attendance and then trying to limit our movement. And to some extent, you see, if you remember totalitarian states, this is how it starts. They lock you down. That's why lockdown will not happen again, to manipulate you, So, but we have not been able to deploy sufficient information.
You think it's not possible to lock down again?
It's going to be difficult. It's going to be difficult. You can. Okay. It's not going to work. Okay. You have to devise smart means of dealing with these things. So our information, people just look at it. Which mask, which hand washing. So the best you can do is to find means of giving them vaccine. Even that vaccines, I have respected friends who have told me that I didn't take vaccine. Look at me, I'm still alive. And I say, yeah, lucky you, okay? So we shouldn't slow down the information as much as Nigeria Center for Disease Control is talking, various primary healthcare centers should be talking, the state government should be talking, and should be having, should never allow this discussion to leave the public space, As the thing is rising in China, tell your people so that they can do the minimum that is necessary. What is the minimum? If you don't have reason to go out, to mix with crowd, don't mix with crowd. If you need a booster dose, take your booster dose, and then report your complaint to hospital as much as possible. Unfortunately, I have 24,000 doctors treating 206 million people. That's the situation in Nigeria now.
Talk to us, because that area is very scary, if you ask me, in the eyes of the way the numbers came, when government is saying, well, we can't afford this now. A lot of our doctors that were around at COVID time, many of them are no longer around right now. Some are in the UK, some are in America, others are in Canada, some are even in China, some in Saudi Arabia, as the case may be. What is the situation in that regard, regarding the inadequate manpower that we have in the health sector right now?
My brother, you have to cope with that for a long time. Don't let us deceive ourselves. You know why? Because, you see, the least time you can use to train a person in health workforce is 4 years.
4 years?
Yeah, that's the least now. Even 5 years, nurses, laboratory scientists, pharmacists, 5, 6 years. And then you have to actually, if you add the doctors to it, that means you are doing like, 6 years initially, another 4, 5 years if you pass on time. So now, who's going to wait for that? It's an era nobody wants to wait for anything. If you can sing, you make money. If you can do skit, you make money. Why would anybody want to study medicine? And then what are the incentives that have you put in place to help people study medicine? You have not even helped teachers. Okay, I'm going to come to this, very key. Now, you see two dilemmas facing Nigeria now. One is this. UK is taking your teachers. UK is taking your doctors. Now, in a society, when you remove the teacher, you have removed everything. Economy will suffer. Health will suffer. Politics will suffer. Even morality will suffer.
Germany knows that very well.
Because that is the key. Teachers is the key, is the foundation. Now, your better teacher will be taken away. Your doctors are taken away. Your brains, in terms of even ITs, have been taken away. And you are left with remnants. Remnants will not develop any country. If I were to be, the government of Nigeria, I would call my Nigeria Teachers Council and say that, listen, nobody can live here. No, none of my teachers. Yes, I've tried to improve on the teachers' situation because, you understand, education is fundamental. Education is not just a social concern. It's an economic issue. It's a political issue. Education is the foundation of every nation. And then you now see somebody packing your teachers away, taking your doctor away. And then even those teachers, you are not stimulating them to teach science courses, which will lead to production of science students that can do medicine, do lab sciences, do pharmacy. You are not incentivizing that. Everybody just want to read political science or whatever and go and do skits. Abi? So if we're going to be a skit-based economy, nice. Let us enjoy skit. But when we sick, let's be ready to die.
But young people are...
Because in the university,
young people are creatively trying.
Wonderful. I love the energy in the entertainment industry.
Right.
A country that I understand properly will use that to even stimulate an economy. But life is not about entertainment alone. Life is about life itself, and the life must be saved. Must be. I agree that you may not have, but at least there must be a situation of minimal, provision. Scandinavia used to be like Nigeria about 80, 100 years ago. They die young, all those things. Everybody sat down and said, guys, what's going to happen? Unless there's an accident now, you will get to 80 before you die. In that kind of, at least 70 in that kind of country. Things don't just happen. You have to plan for things to happen. Okay? But if everybody feels that all I need to do is satisfy my belly and my sex organ, that is what Nigeria is all about. It's about your belly and sex organ. So people want to run around to eat, to satisfy their sex organ. The greater issues of compassion of the heart, empathy, consideration, because why would anybody still 80 billion? If the person thinks that compassion is important about providing for those multidimensional poor people, those children on the street. So leadership has not raised governance to the level of thinking at the level of the heart. Why is that so? I don't know. You have many churches, you have many mosques, you have many religious institutions. All of them are preaching how to be. All of them are putting their mouth in the politics. Ask them the critical issue of morality does not concern them. Well, that's where we are. We'll run along. We'll swagger, this and that. We'll get somewhere. Abi?
Your positions this morning is really something else. But the point there is, health workers are saying government should do something about restricting people, especially those, coming from China and some, specific countries around the world. As it is right now, government has tried to, as a way of, relaxing some of those strict protocols that one has to get into. But if government has to upgrade, what are we looking at if government has to upgrade those restrictions again?
It's simple. Are you coming from China? Where's the certificate of COVID? Just upload it.
Okay.
Even as you're taking your visa, upload your certificate of negative result. 1. 2, government should increase the surveillance, especially the genomic surveillance at the level of the airport and port. 3, government should actually improve on the communication to its populace on the new variants, the symptoms, and what they need to do. Those are not simple enough. What extra money do you need to spend to ensure those things? And then they seek collaboration. Because you must be able to figure, because you see, this year budget, 5% health, to do what now? So to do what in reality? So you have to seek those collaborations and then ensure that we're not saying you shouldn't come, upload your negative results. At least let's collaborate so that you can come here easily. At the airport, genomic surveillance, do random sample. Push for genomic surveillance for people, inform your people, tell them we have a new variant. This is what we should do.
Nigeria is still, from the body language of government, it looks like we are still not, they've still not decided to look into the critical area. Like you mentioned, the issue of allocation to budgets, budgetary allocation to health. We've been talking about this for many years. Health and education are very critical areas. And in fact, if you look at the budget, recurrent expenditure still outweighs the capital expenditure for the year. And it has been happening like that, as the case may be. But the point there is, if we have to start looking at it critically, where should it really start from? Because this issue has been on over the years, where you just have 4%, 5%, sometimes 6%, or maybe most of the times in the last few decades, 7% allocation to health or even education, as the case may be. So
we need to rethink how health is funded, how health is delivered. This critical rethinking means that, you see, I must be able to relate with the community, primary healthcare, state, and federal. We must have a synchronicity across, this, so that, because what we need to do is to look at your community, empower people with information in their language, what they need to do, common diseases in the area. Because we're not going to get that money. Look at this year's budget, deficit funding, so how much can you borrow again now? So, you have to actually look at those from those local level. The instrument we have now is communication, is health literacy. That's the instrument we have, which can be devolved to the lowest level in governance. And then what we need to do, we should be talking more, putting visuals out more, and working at the local level. That one, the community health workers can easily do that. And then we should be able to take data and look at how diseases evolve in each of the community. That's where we're going to start. We're not going to get money suddenly, you understand? Because in reality, if you push the money there, some people are waiting to whack the money. That's another issue. Corruption, in health system is another big problem. At a point in time, one of these funding agencies was very angry. It was not able to fund us because a lot of that money put into the health system in Nigeria was whacked. So we have to actually, like I said, let's raise, our stomach is important, and our sex organ is important. Again, let's punish it a bit and raise to level of compassion so that when money is given for certain things, because it is important. If you are getting 5% and the 5% is working, and if you add the basic health fund added to it, and you have some other agency contributing money to it, if you use it, you will see a little result. But the money is worked.
All right. We look forward to the possibility of government putting strategies in place to prevent the whacking of the way you put it, so that more monies are not whacked. At least let them be used for what it is meant to be used for. Thank you so much, Dr. T. Mebaondu, public health consultant. We really appreciate you coming on the program.
It's my pleasure always, my brother.
Thank you.
Yes,
right.